My question is for Ms. Francis. I noticed in your departmental plan there is focus on the credential recognition for internationally trained healthcare professionals, and I wonder in these estimates how much is earmarked for that type of work. It talks about innovative programs, and I wonder what those innovative programs might entail.
All right. My colleague Jo Wizin will come in and answer that one for you.
Thank you for the question. So in terms of foreign credential recognition and work that we have on health workforce overall, we're working with provinces and territories mainly on commitments, and they made several commitments at the last health ministers meeting. Sorry. Regarding the health workforce. So included in that was, for example, a commitment to meet a 90-day service standard for licensing for internationally educated health professionals. And so we've been working with them to make sure that they can meet that commitment. They're looking at an ethical recruitment framework when we do international recruitment. And also working on issues related to labor mobility. So when professionals come into the country, that they can actually work across provinces and territories. And in terms of the innovative programs, I don't have the number in front of me, but maybe Serena can find that. We are also working with the national organizations. So the National Physician organizations, for example, with the Medical Council of Canada, is working on a registry for physicians, which would be really the foundation to allow for labor mobility. And the same way is working with the national organizations for nursing. So they're also working on a registry, which is really what would allow that labor mobility across the country. And also working on sort of programs like a triple track assessment for nursing. So, for example, when a nurse needs to be assessed to come into the country, there's several different tests that they have to go through in terms of that assessment. So their education assessment and the verification of their credentials, but also the licensing process. And so they're looking at innovative models where they can actually accelerate and streamline that process so they can get to work faster.
I have another question with regards to expanding Canadians' access to family health services. There's mention of transforming the delivery of primary care, interdisciplinary teams, virtual care. Can you tell me what in the estimates is included in this bundle?
In terms of the estimates, so it's the funding for the bilateral agreements. So the government announced $200 billion over 10 years to support provinces and territories to improve healthcare for Canadians. And as part of the estimates is included the money that we're flowing to provinces and territories for the bilateral agreements. So that would be the sort of the first year of that funding. So we've signed all the agreements with provinces and territories in this fiscal year. And they have 4 priorities where they can invest that money. The real main priority is that family health teams. And a lot of them are doing really innovative things in terms of moving to a model of team-based care, looking at alternative payment models, really bringing sort of virtual care into their public systems so that they can provide that care to Canadians. Nova Scotia is looking at a registry where, a lot of them have like a registry. If you don't have a family doctor already, you can actually access virtual care first and then, get connected to a family care provider. So we have all those bilateral agreements have action plans online where provinces actually detail what they're doing with the funding, and they have targets and indicators. So these agreements are 3 years. So they've set out indicators and targets for those 3 years. And we also have them sharing data with CIHI, which is the Canadian Institute for Health Information, in terms of common indicators so we can actually measure progress across the country in terms of access to care.
Excellent, thank you. Do I have time for one more?
Great.
You also mentioned, Ms. Francis, about digital tools. Can you expand on that? Is that like EMRs, virtual platforms? What is that? Or back to you.
Back to me, yeah.
It's all her stuff.
Okay.
So another one of the priorities in these bilateral agreements is modernizing the health system with digital tools. So there's actually a full health data agenda with the provinces and territories. And in terms of the digital tools that they're investing in is mostly in terms of EMRs. So these are electronic medical records in a physician's office. And what we're doing is trying to make sure that those are connected to the rest of the healthcare system and that patients have access to their own health information. So those are really the goals of those initiatives. And as part of signing on to get their funding for the health agreements, provinces and territories had to agree to 5 data commitments. So one was sharing common indicator data with CAI to help us measure progress. The second one was adhering to common interoperability standards so that that information can be exchanged across the system and shared with patients. The third one was actually aligning frameworks. So really part of the barrier to sharing that health information is not necessarily technical, it's really culture. And even sort of those privacy legislations don't prevent that sharing of data. But there is a culture of concern about allowing that data to be shared. So it's really looking at data stewardship and aligning all the partners so that there is a culture of sharing with privacy measures in place to protect Canadians, but ensuring that, again, they can get access to their own data. And the third one is really adhering to the principles of a health data charter. And some of those principles are, patients' right to have their own data and their own health data, and as well as respecting Indigenous sovereignty over data, so OCAP. And so really kind of moving all the country in sort of the same direction from a culture of custodianship over data to a culture of stewardship over data. And then the last commitment is public health data sharing to make sure that we can manage public health events. So that's really those big parts of a joint agenda that we're advancing with the